everyone. Welcome back to our channel. I'm Dr. Kat Karami, Medical Director of Allurant Medical. And today I want to talk about a fun, well-known area of treatment called fillers. So I want to go back to basics and talk about what are fillers. Fillers fill a gap, a loss of volume in a place in the body, mostly in the face. The most common fillers in North America are hyaluronic acid fillers. Hyaluronic acid is a sugar that is naturally made in our body and it exists in our skin. Hyaluronic acid is a molecule that, when injected into the skin, sits there, absorbs water, and plumps up the tissue around it. So effectively smooths out the line like a balloon that has lost air. When you put air in it, it plumps up and smooths out. Now, recently, there's been a big concern about putting fillers into our faces. There's been a lot more awareness of the fact that fillers are not going away as fast as we thought they were. We thought every 6 months to a year, the filler is completely gone and you need to replenish it in the cheeks or in the lips. And as people are having more imaging done, ultrasound, MRIs, CAT scans, they're seeing that this material is lasting in the face and especially around the eyes, in the cheeks. So we're aware that the fillers are not necessarily going away as fast. The use of fillers need to be done judiciously in the right place for the right reasons. And there are other kinds of fillers that are suitable for revolumization as well. One is biostimulators that we've talked about in a different video, and that's products like Sculptra and Radius that stimulate the production of your own collagen. They're really great for mature skin and also for overall volumization. So you don't want to sculpt, but you want to plump up overall. The best filler of all is, of course, your own fat. So if you are able to have fat transferred from an area where you don't want the fat to an area that you do want it, in the face or in the hands and the breasts, that is the best kind of volume. Fillers are great to have a place, but you do need a good consultation and review of what you want, as well as what kind of tissue, what kind of limitations you have before you get the result that you think you want from fillers. So if you're curious whether fillers are a good fit for you and your aesthetic goals, reach out on our social media channels or go on our website and we will connect you to have a complimentary consultation with one of our providers.